Good morning. I am Dr. C. Selvi, Assistant Professor of English, APA College for Women, Chinnakalaimattur. Good morning. Now I am going to take the stricture involved. That means manner of articulation. By the word stricture, we mean the relationship between the active and passive articulators. In other words, do the active and passive articulators touch each other during the articulation of a consonant, or is the active articulator brought very close to the passive articulator without touching it? There are a number of strictures involved during the articulation of consonant sounds, and these are described here. If we know the stricture involved during the articulation of a consonant, we can describe the manner of articulation of that consonant. There are different things are here. First, let us see one by one. The first one, complete closure and sudden release. By the expression complete closure, we mean that both the oral and the nasal passage of a are closed completely. The nasal passage of a is closed completely by raising the soft palate so that it touches the back wall of the pharynx. The oral passage is closed by making a firm contact between some active articulator and the corresponding passive articulator. Example, between the two lips or between the tip or blade of the tongue and teeth ridge, or between the back of the tongue and velum. The air from the lungs is thus imprisoned behind the two closes. When the active articulator is suddenly removed from the passive articulator, the air rushes out of mouth with the slight explosive noise. Sounds articulated with a structure of complete closure and sudden release are called plosive or stops. In English, there are 6 plosive consonants. These are P as in spoon, B as in about, T as in stool, D as in lady, K as in skin, and G as in ego. These are some of the 6 plosives. D, T, K. P, T, K are voiceless plosives. B, D, G are voiced plosives. In terms of place of articulation, P, B are bilabial, T, D are alveolar, and K and G are velar. The plosives that occur in English are given in the table also. Here, plosives. The next points, the complete closure. Complete oral closure. There is an oral closure made by some active articulator making a firm contact with the corresponding passive articulator, but the soft palate is lowered and it comes away from the back wall of the pharynx, thus opening the nasal passage of air. The air from the lungs escapes freely through the nostrils. Consonant sounds articulated with a stricture of complete oral closure are called nasals. The sound M refers mat. The sound N, nice, ing, ankle, are the 3 nasal consonants that occur in English. The next, complete closure and slow release. The soft palate is raised and it touches the back wall of the pharynx and thus closes the nasal passage of air. In addition, an oral closure is also made by some active articulator touching family the corresponding passive articulator. The air from the lungs is that imprisoned behind the two closes. The active articulator is removed slowly from the passive articulator and the air escapes the slight friction. Sounds articulated with the stricture of complete closure and slow release are called affricates. Example, dish, idge. The next, close approximation. The soft palate is raised and so the nasal passage is closed completely. The active articulator is brought so close to the passive articulator that there is a very narrow gap between them. The air from the lungs escapes through this narrow gap, producing audible friction that is called the sounds articulated with a structure of close approximation are called fricatives. There are 9 fricative consonants that occur in English. F refers fan, V refers van, it refers thin, ta refers then, is sun, ij